Dr. Megan Smith, how fantastic to see you, and thank you for joining me on this brief 5-minute interview about RAUK 21. How are you?
Hi, Amit. It's lovely to join you. Lovely to see you. I'm good, thanks. I'm really good. I'm enjoying getting back to a little bit more normality and back to the normal day job of giving anaesthetics and, more importantly, giving regional anaesthetics.
Absolutely, and it's also great for me to welcome another of our Guy's and St Thomas's consultant colleagues to the meeting, which is brilliant for us. So, to people who don't know you, it's amazing that I think you possess that perfect combination. So you're a consultant anaesthetist with a special interest in regional anaesthesia, and you're a barrister at law. So how amazing is that?
Yeah, all someone's worst nightmare. It's hard. You decide.
Exactly. So it's what's interesting for me is to ask you what you're looking forward to about RUK 21.
Sure. Well, I think like everyone, I'm looking forward to going somewhere that is not home and not work in the last year, because all of us have never really haven't really been able to go and do very much at all. Also, my brother-in-law, who I adore, is from Sheffield, and so I'm really looking forward to going to his home patch. And I'm a northerner at heart and by birth, so it'll be really nice to actually get up north and get a decent cup of tea as well. So that'll be great.
And what do you think is important? Why do you think it's important that we should get people to register for RUK 21? What must they not miss out on?
I think that you have to be on board, and I think more and more of our trainees are, most of our trainees are, but you have to be on board with the idea of regional anaesthesia, and you have to be comfortable with it. For my money, in a few years' time, you won't be able to say, oh, I don't really do blocks. That'll be a bit like an anaesthetist saying, I only do LMAs, I don't really do tubes. You're going to have to be able to do it. Add to that the fact that it's super fun doing it. It's unbelievably satisfying, particularly to see your patient comfortable afterwards. It gets you the most enormous amount of kudos with your recovery, or for our American friends, PACU nursing staff, when you deliver a happy, comfortable patient to them at the end of a case. And it's a great area for teaching as well. You know, so many trainees they really want to learn, and it's such a lot of fun teaching them, and they can get those competencies pretty quickly. So then it's lovely when they come back to you and say, oh, actually, I was doing this other list, and I did that block that you showed me, and it worked really well. And suddenly you've converted someone, and they might go out and convert somebody else. So, yeah.
So, I mean, I think, and we hope that at RUK 21, people will get a chance to see all aspects of regional anaesthesia, talking about, we got, symposia looking at the upper limb trauma through the eyes of a novice, right the way through to things that are really important, like your session, where you're going to be talking about important aspects of consent in regional anaesthesia and what we need to be aware of. So hopefully that's going to there's going to be something for everybody and something for every grade.
Well, exactly. I hope so. And I think that's one of the real beauties of regional anaesthesia, is that there's a block for every grade, there's a block for every person, there's a place to start for everybody, and then a wonderful kind of progression all the way through. So, and I think coming to RAUK, people of whatever grade and whatever level of seniority and experience, there'll be something there for all of them. So I would definitely be encouraging people to come along.
Fantastic. Megan, I've been asking all of our 5-minute interview speakers these 3 questions. So I'm going to, hopefully it won't come as a surprise. I'd love you to tell us what your favorite upper limb, lower limb and trunk blocks are.
So the upper limb, I'm torn with the upper limb block, because I think an auxiliary block is beautiful, and I think it has something for all trainees, particularly. So the superficial bit, a more junior trainee can do, or be guided to do, and then the whole thing a more senior trainee can do. But I'm old enough to have learned the original, which was the original interscalene with a nerve stimulator and no ultrasound. And I think for me, it's just one of the most satisfying blocks to do. It was my first ever, and doing it with ultrasound is even more exciting and fun. And it's one that I love teaching to trainees, because they get such pleasure out of visualizing the anatomy. So I'm gonna go with the interscalene. I'm afraid I'm gonna dump the auxiliary for
and are you going to go with the interscalene ultrasound guided or nerve stimulator guided?
I think, given the fact that I'm going to be speaking about law and partly how not to get sued, I'll definitely be going ultrasound guided.
Possibly even dual guided, maybe even with
yeah, some people do it. I've never done that, but yeah, some people do. But definitely an ultrasound has to be there. Definitely.
Perfect. What about lower limb?
Lower limb, I think, again, for teaching purposes and also for patient purposes, I think that a popliteal T or sciatic, at that point where the sciatic divides, is a really lovely block to teach. It's great for teaching needling technique. And it's one of those blocks that can really get you out of a hole when you've got one of those patients who is just not a GA candidate. I think I'd probably go for that. And also it's one that's versatile, and really now we're being able to move towards putting catheters into that nerve sheath in order to give some analgesia to patients. So I think I'm gonna go with that one. It's an oldie, but it's got a bright future as well.
I think I think I agree with you. And actually, what's interesting is it's one of those blocks that really stresses the importance about ergonomics and pro-positioning and isotropy. So lots of things to learn. And then we're going to
100%.
finish up on your favorite trunk block.
Yeah, I think you might know. Yeah, I think you might know. So I'm just 100% an erector spinae plane block fan. I learnt about them at ASRA back in, I think it was 2018. I think it was in New York, and I came back and started to use them, and I think they're fabulously versatile. I mean, you can use them for so many different procedures. And I'll stick my neck out and say that I think that one day bilateral ESPs with catheters will replace epidurals.
Wow.
Yeah, there you go.
That would be
dropped mic.
Yeah, that is definitely a mic drop. You heard it here first.
Yep.
Dr. Megan Smith says epidural is dead. Okay.
I'll await a Twitter storm.
Megan, it was fantastic talking to you. Thank you so much for taking the time to speak to me, and we look forward to seeing you really, really soon. Take care. Thank
Likewise,
you.
I can't wait to get there. Thanks so much.